Other patients come to me asking for eyelid surgery because they tell me that they look tired, their eyelids are sagging, or they have puffiness under the eyes. And really, when we examine them, it's not that they just need eyelid surgery. It's actually a brow lift that's what they need. The reason for that is when we age, right, our forehead and brow really relaxes first. And then in later years, the eyelid relaxes. When patients come in, we'll discuss all these options with them. There is two main ways that we do the brow lift in our practice. It's either endoscopic, which means that we use a very small camera. It's a 4mm camera, and we make a few incisions, small incisions, less than an inch, up in the hairline here and one on each side in the temples. And then we use the camera to really lift the entire forehead and brow. And I know that patients do not want to look surprised. So it's done very conservatively, very judiciously. We measure everything. And really the only part that is being lifted is the tail of the brow, or the outer portion. The central portion is not lifted because we know that if you lift the central portion, people look surprised, and so we don't want to create that look. So it's done like that. Everything is done. We can see everything magnified on a big screen, and we can see the nerves very clearly. Very beautiful surgery done in an hour. And then we fixate everything internally to a bone tunnel, and it's closed, and you really don't see anything afterwards. You just have a few sutures in the hairline. The other way that we do it is called an open brow lift. An open brow lift is an incision that is made just across the top of the forehead, but it's also done inside the hairline. And the incision is made in a way that the hair follicles grow back into that scar. So also heals very well. And after a few months, I can't even see the scar. There's, a year after, it's beautiful. Nobody can tell. The advantage of doing it open is that's the only way that we can lower the hairline. So if somebody has a very long forehead and the forehead is sagging, they have lines, wrinkles, they have sagging brows, and they want a forehead or a brow lift, an endoscopic or a coronal or any other way that we do it will lengthen their forehead and raise their hairline a little bit more. The only way I can lower that hairline and not make their forehead look longer is with an open brow lift. So it's an excellent choice. The recovery is easy. Patients do very well. They have minimal discomfort after surgery. And as I said, the scar heals very well, as you can see in the pictures.